Well, Tumelo, in the Western Cape, there's been a lot of concerns, or especially from the processes of who gets to be approved by the app when they register, because in the past or last month during the first phase of the rollout, there's been a number of people who weren't or aren't healthcare workers were able to register on the app and get those vouchers in order for them to get vaccinated. And I spoke to the CEO of Rotaskir, Dr. Patel, who was saying that it's unfortunate that there are people who are being approved by the system and they are going to get vaccinated, and at the hospital they don't really verify the information, because a lot of if you get approved by the app, you will be required to bring your registration number as a healthcare worker or your ID number. And in some cases, if people don't have those particular documents, they only have their vouchers, they will be allowed to get vaccinated. So she was saying that it's also concerning from their side that even though they cannot verify those information, but there are people who are continuing to register and being accepted by the system. And there are also people who are registering who are not 60 and above, who are still getting vaccinated. And it's also part of the system, not the healthcare department in the Western Cape. But we heard from Ellen Windy last week releasing a statement to saying that 53 new sites have been increased in the Western Cape to ensure that they deal with the number of people or the volume of both the elderly people and some healthcare workers who are still being vaccinated. 6 new sites are also added in the rural areas to also assist in those particular areas for the elderly people.
About capacity in that instance, Nobesuthu, speaking about assisting more, people coming in to vaccinate, particularly when we look at the senior citizens and healthcare workers still receiving their jabs. Take me through, perhaps, in a bit more detail, the plans that the Western Cape government has to increase that capacity. Can we expect more healthcare workers to be dispersed to these vaccination sites and assist in this regard?
Well, what I can tell you, Tumelo, is that currently when I spoke to the PR person from Khayelitsha District Hospital, he was telling me that this morning their healthcare workers are actually going out on the field to vaccinate a lot of the elderly people, going to the old age homes and other facilities if they can't make their way to the hospitals or the vaccination sites. So the Western Cape government is trying by all means to ensure that they will be able to vaccinate a lot of people within the time that they're supposed to carry out or conclude the phase 2 of the vaccine. And they're doing it concurrently with some healthcare workers who are not able to vaccinate during the first phase. So they are making sure that all people will be vaccinated in time